This is part two of the lecture for endocrine system medications. In this lecture, we're going to go over the pancreas and diabetes. So the pancreas is located in the abdominal cavity. It releases digestive enzymes and regulates blood sugar. It regulates blood sugar by the secretion of insulin, which brings the blood sugar down, and secretion of glucagon, which increases the blood glucose. Normally, blood glucose levels, they increase slightly after you eat. When blood sugar rises, the cells in the pancreas release insulin, causes the body to absorb glucose from the blood, and lowers the blood sugar back down to normal. So let me simply try to explain how the body uses carbohydrates again. So when you eat carbs, your body breaks them down into simple sugars, which are absorbed into the bloodstream. As the sugar levels rise in your body, the pancreas releases a hormone called insulin. Insulin is needed to move sugar from the blood into the cells, where the sugar can be used as a source of energy. Hypoglycemia is caused by too little glucose in the blood and can lead to death. If the patient has low blood glucose, the cells don't have enough energy to function to do what they need to do. I think we've all gotten a little hypoglycemic at one time or another when we haven't eaten for a long time. Hypoglycemia can occur with prolonged fasting, missed meals, severe malnutrition, or prolonged strenuous exercise. You can be restless, shaky, and lethargic, but if it's left untreated, hypoglycemia can cause seizures and coma. Hypoglycemia is usually treated with a small dose of both, like hard candy, orange juice with sugar. Patients may carry an oral glucose preparation. If they are unconscious, they may be given injections of glucagon. So here's the mnemonic: cold and clammy, need some candy. Diabetes mellitus is characterized by hyperglycemia or high blood sugar. There's type 1 and type 2. Type 1 is insulin-dependent diabetes. With type 1, there's a substantial decrease or lack of insulin. There's also type 2 diabetes or non-insulin dependent diabetes. This is when insulin is produced, but the glucose levels aren't lowered the way they need to be. Genetics, sedentary lifestyle, and obesity, these are major contributing factors to non-insulin dependent diabetes mellitus. When sugar is high, the skin may be hot and dry. Hot and dry sugar is high. Patients will also have increased urination because the cells are excreting water to flush glucose out of the blood vessels into the kidneys. There's also increased thirst because the cells are dehydrated, and increased hunger may happen because of glucose in the bloodstream and it's not making it to the cells where it's needed. If hyperglycemia is not treated over time, body organs are affected. It's important that our patients and we as allied healthcare professionals understand this. This high blood sugar damages nerves, so vision will worsen and feet can become numb. Wounds may not heal and kidney function can suffer. Cardiovascular disease may also occur. Steady glucose levels can delay or minimize these complications. If the blood sugar is extremely high, the patient can develop ketoacidosis, where there's an ineffective burning of fat. This can be a life-threatening condition. Insulin is required for type 1 diabetes. They may also be given for individuals with type 2 if steady glucose levels can't be achieved with oral diabetic medications. There are many types of insulin, and it's critical that the professional know the type of insulin they are giving. The peak onset and duration of these types of insulins can really vary, and giving the wrong type or at the wrong time can be detrimental to the patient. Rapid acting insulins are your logs, Humalog or Novolog. Think of log, log, log rolling down the hill. The generics are Lespro and Aspart. These insulins start working in about 15 minutes. Next, there are short-acting insulin or regular insulin. These are usually prescribed on a sliding scale and are administered before meals. A sliding scale means that the dosage that's given depends on the assessed blood sugar. Onset of regular insulin is 30 to 60 minutes, peak is 2 to 4 hours, and duration is 5 to 7 hours. Intermediate acting insulin, or intermediate NPH, is usually mixed with other insulins to slow absorption by the body. NPH is cloudy in appearance, and this happens because the particles of insulin are not fully dissolved. This insulin requires mixing, which simply may mean rolling the insulin between your hands. This mixes the insulin without creating a lot of bubbles. Long-acting insulin, such as Levemir or Lantus, can last up to a day or a day and a half. Gargine or Lantus should never be mixed with another insulin. An insulin pump may be an option for patients with a history of poor blood glucose control. These pumps are usually used with short-acting insulin. A small needle is inserted subcutaneous, usually in the abdomen, and the pump is hidden under the clothes. The pump delivers insulin 24 hours a day. Many times the pumps are adjusted to deliver different dosages throughout the day, and some of them have the option to give a bolus or an additional dose to cover a meal or a snack. Knowledge of the handling of insulin is important. It needs to be refrigerated until it's opened. Refrigerating insulin will extend the shelf life up to 1 or 2 years. Once insulin is opened, it has to be kept at room temperature and discarded after it's been open for a month. You know, insulin is a protein dissolved in water. You can think of it like a soup broth. Like most proteins, it can spoil. Keeping it cold helps to keep it from spoiling. Bacteria growing in it, it will break down the protein. This insulin will not poison you or make you sick, but it won't work very well. You always want to label the container of insulin when you open it with the time and the date. Also, make sure you're aware of the facility guidelines for storage and expiration. If an injection is given with the insulin at room temperature, it will make injections less painful, but my experience is that insulin is usually kept refrigerated in most facilities. When we administer insulin injections, they are given subcutaneous, always. Injection sites must be rotated. Scar tissue or abscesses can form, and insulin will not be absorbed if we don't rotate sites. Rotation allows for even absorption, which in turn helps to maintain steady glucose levels. Sites ideally should be used no more than 1 time a month and should be an inch away from other sites. You know, insulin can be given IV, and that's usually your regular insulin. Type 2 diabetes can be managed with diet alone or with oral diabetic or anti-hyperglycemic agents. These medications work in different ways to control blood sugar. Some anti-hyperglycemic drugs encourage the pancreas to release insulin, while others encourage the liver to tell the pancreas to release insulin. Other medications can inhibit glucose absorption from the intestine, and lastly, others can increase the sensitivity of the muscle cells to insulin. You will see some medications listed as first or second generation. Whether a drug is first or second generation is based on when they were released. The second generation anti-hyperglycemic medications tend to be more potent and tend to be safer. We now have new incretin agonists, which we'll discuss in a moment. Incretin is a hormone that stimulates insulin after you eat. So metformin is our most common oral anti-diabetic medication. It's in a class all of its own called a biguanide. Metformin, which brand name is Glucophage, is our first-line medication for the treatment of type 2 diabetes. For side effects, I think of like the doctors like metformin, so like, L-I-K-E. First, L is for liver. Metformin's main site of action is in the liver to reduce the excessive sugar release seen in type 2 diabetic patients. Also for L, watch your patient for lactic acidosis. This is a buildup of lactic acid in your blood, which is very dangerous and usually fatal. The I is for IV dye. This medication must be held if the patient is having an IV dye study because it competes for the same receptor sites as metformin. K is for kidneys. Metformin is eliminated by the kidneys, and when a patient has poor kidney function, metformin can build and cause serious side effects like lactic acidosis. Lastly, E, and that's for eat. The main side effect of metformin is diarrhea and stomach upset and cramping, so it's important to take metformin with food to reduce stomach-related side effects. There are some fairly new drugs that are on the market now that are really exciting. These are called incretins. So what are those, you might ask? Well, incretin again is a hormone released by our gut. It stimulates the release of insulin after we eat and inhibits glucagon secretion. Remember, glucagon brings sugar up. It also slows gastric emptying and helps us feel full. Can you see the benefits of these medications for diabetics? So GLP is an incretin, which again is a hormone that stimulates insulin release and inhibits glucagon after eating. These medications end in TIDE, T-I-D-E. Liraglutide, or the brand name Victoza, is a GLP agonist. Common side effects of these medications are nausea and vomiting and diarrhea. The patient must be assessed for pancreatitis. Signs for pancreatitis is nausea, vomiting, and abdominal pain. This medication is a daily injection. Patients should be taught proper administration and to not mix this medication with insulin. Here's another medication that works with the incretins. Sitagliptin, or Januvia. This is a DPP-4 inhibitor. DPP-4 is an enzyme that destroys the hormone incretin. So again, remember that the incretins encourage the release of insulin when you eat. So if we keep the incretins around, there'll be a decreased glucagon concentrations and increased responsiveness of insulin release to the glucose. The FDA, though, has issued a new warning about the possibility of severe joint pain with these medications. It usually stops in about a month after the medication is discontinued. Again, we must assess our patients for pancreatitis and also rash or Stevens-Johnson syndrome. Cystic fibrosis is a progressive genetic disease that causes persistent lung infections and limits the ability to breathe over time. In patients with cystic fibrosis, a defective gene causes a thick buildup of mucus in the lungs, the pancreas, and other organs. In the lungs, the mucus clogs the airways and traps bacteria, leading to infections and extensive lung damage and eventually respiratory failure. In the pancreas, the mucus prevents the release of digestive enzymes that allow the body to break down food and absorb vital nutrients. These need to take replacement enzymes such as pancreolipase, which must be taken with food for a lifetime. Well, this wraps up endocrine system medications. If you have any questions, make sure that you let me know. Write them down, bring them to class.